Hey guys, Frank Colley here. I wanted to share this really quick but important video with you. Are you someone who is suffering with hip pain or groin pain or symptoms into your butt area or maybe even back pain, and you're thinking that there's something wrong with your hip or that your hip is out? I'm here to tell you that more than likely that is not the case. Very rarely it could be, but more than likely it is not the case. You could be someone who is suffering from an SI dysfunction, also known as a sacroiliac dysfunction. That is a joint that is in the back area below your lower back, but above your tush, right in that area. And simply put, what happens is where the pelvis and the back come together, there is a joint there. It's called the sacroiliac joint, SI joint. And sometimes that joint can get shifted or go out. It could be due to a bad fall, you landed on one of your butt cheeks or your hip, or you stepped off a step the wrong way, or you're in a car accident and had your foot on the brake and it got jammed back. It could sometimes do that, and it very easily mimics hip pain and or back pain. So here's one of the biggest things that we see when we look at someone that is having possibly an SI dysfunction. So I'm just going to move over to this individual right here and just show them real quickly. One of the things that we do is we take a look at their legs. Now, I've already done this with her. Just bend your knees for me, please. I bring them up, I bring them down, which is, this is something you could do at home, and then straighten them all the way out. And one of the things I look at is their feet and their ankles. And one thing I see with this young lady is when I put my thumbs on both of her ankle bones, they don't even come close to being even. They're overlapping, which means she has a leg length discrepancy. Now, sometimes people can have a leg length discrepancy because they broke a bone in their leg and it either healed longer or shorter than the other, or they may have had some sort of hip surgery or knee surgery that caused that. But if you haven't had any of those things and you have one leg that seems longer than the other, which structurally sometimes we do have a small deviation just the way we were born. But if this seems to be something that's relatable to you, you very well could be suffering due to a sacroiliac dysfunction. And there's great news for you. It is super easy to fix very quickly. And you can assess yourself at home the same way I did. Bring your knees all the way up to your chest, or have someone do that for you as long as it doesn't cause you pain. Then straighten them all the way out with a little extra pull on the end, and just check those two ankle bones and see if they're matching up on the inside of the ankle, or see if they're uneven. If they're uneven, you can also check the bones at the top of the pelvis here that we come up, and we reinforce that when we get on those 2 points, and they're going to be the same way. They are not going to be even. They're going to be asymmetrical, which usually is a very strong indicator you have an SI joint dysfunction. And again, super easily treatable, doesn't require medications or injections or painful surgery. It can be fixed super fast in physical therapy. So if you have any questions on this, feel free to call our office at 208-2787 or send me an email at colleyptfrank@gmail.com, and I'm happy to provide you with any answers that I can. Have a great day. Thank you.